Well, good day, everybody. Welcome to the Lifetime Training Podcast. And I am very excited to bring you today a category that we've been missing for a long time on this podcast, and probably one of the most important aspects of you achieving any type of goal that you want, let alone any health, happiness, or whatever it is. And we've got Dr. David Shirazi, who is a doctorate in dental surgery, master's in Oriental medicine, a board certified licensed acupuncturist, master's in psychology, and a sleep technician. And his lifelong study has been on sleep and how to improve it and everything there is about it. And that's what we're going to go into today. So I can't thank you enough, and welcome for being on the show, Dr. Dave.
Oh, thanks so much. It's my pleasure. Thank you, Jason.
Awesome. Well, I love how you use the term sleep hygiene. And, just overall, this is about the importance of sleep and the different types of sleep and, what type of sleep we need to live healthy and happy. And I'd love for you to just kind of start there. And why is sleep so vital to living a healthy, happy life?
Yeah, thank you. So sleep is arguably the most vital aspect of survival, even above diet and exercise. And that's mainly because there's two stages of sleep that are crucial to life. One is REM, as we all know, and the other is delta. REM is rapid eye movement, right? That's when our brain goes into a different state of theta waves. And a lot is actually going on, not just the fact that, parts of your body shut off, parts of your body turn on and become very active, but also there's a lot of cleanup that's happening in the brain when we're in the REM stage. So we actually have the lymphatics in the brain are actually called the glymphatic system. And we actually remove beta amyloid plaques from our brains during that stage of sleep. So incredibly important. And so that's just the physiological side. The actual purpose, we believe, of REM sleep is for processing emotions and converting short-term memory to long-term memory. Wow. Right? Mm-hmm. So that's why you'll see people get all worked up when they don't have a lot of sleep, is because they haven't been able to process from yesterday or the day before yet, right? So they're kind of building up and they're building up. So if someone had like one bad thing or two bad things happen to them in a day, that takes a lot to process, right? And if you catch them at a bad time, as you know, they won't be in their best, psychological form. Now imagine if they had several nights, weeks, months of not getting good night's sleep, and then there's like one thing that happens in 1 week, and then another thing that happens in another week, and it just builds up and snowballs. The other aspect of it, did you have a question about that?
Yeah. No, one of the things you mentioned before, and some of the listeners might be very well versed here or somewhat, but I want to kind of strip it down to the lowest common denominator and say, you mentioned theta waves, and would you mind just explaining that and the importance of that as it relates to that sleep?
Yeah. So theta is like an altered state of consciousness, right? So beta waves is when we're concentrating strongly, right? We're thinking, we're very much in our mind, and we do beta in our REM sleep as well. Theta is like a meditative trance, right? Okay. And then above that, even further, what we call it the dream state, okay, is theta state. Above that is called gamma, which is what people consider channeling, is when they're just the purest form of like knowledge and information is coming through.
Got it. Okay. And so let's take it on then to the next step.
Oh, okay. So the other aspect that I was talking about is called delta wave sleep. And that is where over 90% of our growth hormone is released in our body. And obviously we need growth hormone to grow, as pre-adolescents, but also we needed to repair our bodies afterwards, right? And, following your podcast and listening to other gurus in the healthcare field talking about, how to alter their diet and do this exercise workout that's going to boost their testosterone and boost their growth hormone, and they're going to get just 5%, more growth hormone, etc. And to think you get almost all of your growth hormone in that one stage of sleep.
Wow.
And anything can kick you out of it. Any kind of disturbance. We call that kind of disturbance of our brain waves an arousal.
Okay.
Right. So if you have snoring and sleep apnea, which is my focus of practice, every time you have a high vibration or you have, a choking spell, you get kicked out of that stage of sleep. Right. And it also happens if your bed partner is going through that, right? The bed partner choking or even holding their breath can cause a disturbance or an arousal in the person not even having it, right? But as we were talking before the podcast, like a noisy neighbor's dog, the gardeners with the leaf blower, anything that disturbs our sleep will kick us out of those deeper stages of sleep that we need for survival.
Got it. Now, I've heard some things with regards to the circadian rhythms and specific actual times, like between 10 and 1 is this, and between 1 and 4. Can you go into any depth in
Sure.
that area and what those things are and what happens within those different times?
Yeah. So our cortisol is to peak at 6 a.m. and it's supposed to drop off by 6 p.m. or later. Yeah.
Mm-hmm.
And this is because we believe evolutionarily when it's light outside, that's when we can see things and predators can see us. Right. And we need to be alert. So we're not being attacked. At night, everything is dark. So that's why no one has to think about it. Whenever it's time to sleep, we always go horizontal. We like to be in a quiet place because quiet not only means that we can't hear other people, but it also means other people can't hear us and predators can't hear us, right? So with circadian rhythm, we need this cycle that's actually based on sunlight. It's based on sunlight. And that is what sets our circadian rhythm so that we know to wake up in the morning and go to sleep at night. So as we were talking about in the beginning about sleep hygiene briefly, people that have a hard time falling asleep nowadays, it takes them a long time to fall asleep, so can have what's called a circadian rhythm shift, right? A sleep shift disorder is one of the terms it's called. And that actually we think is being caused by this excessive use of having screens on our face, right? Taking the phone and staring at it, the iPad, the tablet in our bed. And that's really because the brain cannot tell the difference between a photon of light from the sun, a photon of light from a bulb, or from our screens. Right. So it just keeps pushing away our sleep, hoping that it's going to get darker. You follow?
Yep.
So for people that have that, and you can tell you have that when it takes you a long time to go to sleep. But once you fall asleep, if you're not disturbed, you could sleep 8 hours straight, even if it means you sleep until like 11 a.m. or 10 a.m. or noon or something the next day. That is not insomnia. That is a circadian rhythm shift.
Got it.
Disorder.
Okay, that's a good differentiation because again, going back to you're supposed to fall asleep by 10:30 because
you are.
And what are the pros and then if that's not possible, then do you just adjust and do all those things, those processes still happen but at different times? Or
So well, the human body is very adaptable. That's like my kind of like, forgive me, cheap answer.
Yeah.
But we have cycles in our sleep, right? We go into stage 1 sleep, which is alpha wave, and alpha. Everyone goes into alpha as soon as we close our eyes, right? But it's just a relaxed state, and then we go into stage 2. And with stage 2, we actually don't know very much about stage 2. All we can say about stage 2 with these called K spindles is between stage 1 and stage 3 is basically what we can say. But it's a deeper stage of relaxation from alpha where we get more physical, like muscular relaxation. The tone in our muscles goes down. And then we slip into stage 3, which is the delta, right? And delta is where we go into our lowest brainwave frequency. And that's where growth hormone is being secreted in our body. That's where we get the most amount of physical restoration occurs during delta.
Got it. So it's more a case, is it right to say, it's more a case to get uninterrupted, consistent sleep during these phases versus, some people I've heard say that the growth hormone, happens between, I don't know if it's 10:30 and 1 o'clock in the morning. And then, and then the brain repairs itself later in the cycle.
So that's the part where I meant that the body is adjustable, right?
Okay.
So it is true that if, let's say, growing up as kids, we went to sleep at like 10 p.m. and nowadays we're getting to sleep closer to 11:30 midnight, it is possible that we're getting less cycles, right? So we go 1, 2, 3 REM, 1, 2, 3 REM, 1, 2, 3 REM, and we're supposed to get 5 or 6 or more cycles a night. It's been postulated that if you go to sleep at 11:30 midnight instead of 10, you're going to miss out on one whole cycle.
Okay.
Right? That would depend, I would imagine, if you're getting 8 hours, 9 hours sleep a night, because that is ideal. It's ideal to get 8 or 9 hours of sleep a night.
Yep.
But if you can get it, we postulate, just when looking at sleep studies in the literature, that you'll still get the 6 cycles.
Oh, beautiful. Okay.
Yeah.
That's good to know. Because I didn't know some people were religious about 10:30 and you got to be in bed.
Well, because see what ends up happening. This is the part that ends up happening is people have like a work schedule, like they wake up at 6:30, let's say every single morning. Yeah. And so what ends up happening is they also wake up at 6:30 on Saturday and Sunday as well, or on their days off. Yeah. Mm-hmm. And so then it becomes incredibly important to go to sleep at the same time.
Yep.
Right? Because then if you go to sleep at 11:30 midnight, then you are definitely reducing the number of cycles you have, and it might throw your rhythm off, and you might not get into that one stage of sleep at that time of night.
Got it. And it's the going through the cycles that dictate the release. And the more cycles you go through, the more opportunity there is for release. Is that correct?
That's right. Right. Usually we say the first half of the night we get a bit more delta.
Okay.
And in the wee hours of the morning, we get the most amount of REM.
Got it. Well,
that's why we wake up with the dream.
Well, and that's what I was going to say too, because so often, it's happened to me many times where I'll wake up, maybe have to go to the bathroom or something to that nature. And then when I go back to sleep and I go into a deep sleep, and that's when the dream has happened. Can you explain that?
Well, I mean, I think you just explained it yourself, right? Yeah. You can fall back to sleep very easily. And what could have happened was you had such a good dump of growth hormone that your body's processes were being done, and you had to go to the bathroom, right? Yeah. And then when you got out and got back into bed, you were able, not everyone is able, but you were able to resume your cycle. Oftentimes when we break the cycle and have to, fall back asleep, we start back at stage 1.
Got it.
Right?
Yeah.
And yeah.
Nice.
So, now, what's interesting though, and I'm not saying you, of course, but I'm just saying in general, you would think the biggest sign of someone that has sleep apnea would be snoring, but more predictive than snoring to see if you have sleep apnea is if you wake up multiple times at night to go urinate.
Oh, really?
Yeah.
I've not heard that one.
Yeah. Yeah. Well, wow. We were surprised.
Yeah. And why is it?
Because of the autonomic nervous system disturbance. We're just getting arousals. Our autonomic nervous system is like shifting, because we're supposed to be in parasympathetic in our sleep, right? That's the rest and restore phase, right? And sympathetic tone is fight or flight. That's when you're up around. So, but when you're like choking, that's an arousal. That's stimulating.
Yeah.
And so your body switches from parasympathetic to sympathetic, and you just run to the bathroom. And actually, we see this among truck drivers. We see the average age of death, and I don't know if it's changed in the last 10 years. The last time I looked at it was about 8 years ago. The average age life expectancy is 64.
Wow.
And we think that's because one, they have to be very vigilant when they drive, right? It's a high state of vigilance. You have to watch out for other drivers. You have to make sure you're in the right lane because they can get ticketed. They have to watch out for cops, for speeding and all that. And they're on stimulants. So they're smoking, they're doing the Red Bull.
Yeah.
And then at night, because
that's why all the truck stops used to have the mini thins all the time, all over the place. Back in the
day. right. Yeah. And a lot of them are sedentary, right? Because they're sitting on their butt all day. So then what they do is they become obese often, and then they have apnea. And so now they're choking throughout their sleep, and now they're being stimulated to sympathetic.
Wow.
So seeing a stroke is actually, we see that quite often among truck drivers with untreated sleep apnea.
Wow. Great information. Well, and that's, I think, a perfect segue into, that sleep is such an issue with a lot. I would say probably the vast majority of the population. And can you go into, obviously you mentioned sleep apnea, but can you go into some of the other things that are, definitely things that you should not be doing if you have sleep issues, and then we can get into some strategies about how to get better.
Right. So we can talk about sleep hygiene. It's an industry standard term. Yeah. If you have sleep apnea, honestly, the only way it can be tested is with an in-lab or in-home study. Okay. So your bed partner telling you having a microphone, all of that, your ring, the Fitbits and all that, that's all very nice, but it's not going to be the amount of detail you'll get in a sleep study. Right. Yeah. And I have a lot of patients, they're afraid to get a study in a lab because they think, well, if they do it in the lab, then they're going to have to get the CPAP afterwards, right? Mm-hmm. And actually, my entire practice is helping people either get used to CPAP or making them an oral appliance that works as well as a CPAP. That's the intention. And of course, you can also have a home sleep study, right? And that's, you just do it in your own bed. You wear it yourself, you turn it on, you turn it off, and you turn it in. It's really pretty easy. So that's the best way of doing it. The other, we're talking about sleep hygiene. So when you have a bedroom, okay, your bedroom, your bed space, your sleep space should only be used for sleeping and sex, nothing else. Okay. You don't eat on it. The family doesn't get together and have laughs on it. You don't look at your television and you don't look at your iPad while you're on it.
So my office that I'm sitting in while I'm doing this right now probably needs to get moved out of my bedroom.
I would highly encourage that, right? You want to keep it as that. You want to go to bed at the same time every single night. I'm sure a lot of your members are doing, and followers are doing, a ketogenic based diet and are doing intermittent fasting. I actually prefer the kind of, having your last meal before your bed to be a fat-based meal, because that will convert into whatever glucose your body and your brain needs in your sleep, because we can actually wake up from hunger. Yep. Right. And people that have a high carb diet, they process the carbs so quickly that they actually wake up hungry. The brain is starved for glucose. Even though the brain prefers ketones, the brain is starved for glucose. And so I don't recommend that. So me personally, my intermittent fasting is lunch, dinner, and I'd like to get as much of my fats of the day at dinner time, so it carries over throughout the night. And then I'll have my next meal at lunch the next day.
Got it.
Yeah.
Well, let's get into, obviously you mentioned Red Bull and caffeine in general and, various stimulants, and, obviously that impacts cortisol. It impacts different,
for sure it does,
stimulant areas. So, what are your recommendations and what have you found with regards to, either limiting it or completely removing it, depending upon your issue and how big of issues you have with sleep.
Yeah. So obviously, so my, as you mentioned, I'm an acupuncturist and as well as a dentist. So for me, my thought process is always like, how can we fix the organic cause of the problem rather than just paste some band-aid over it. So if you're tired enough, so usually in females prior to menopause, if they have sleep apnea or disturbances in their sleep, they're tired when they wake up in the morning. Okay. Men with normal testosterone levels, after adolescence, if they have sleep apnea, they actually wake up and feel refreshed. Okay, because their testosterone, their hematocrit is so high, and they have a crash in the afternoon, like 4 or 5 o'clock. And these are the people that are doing the Red Bulls and the coffee at like 4 or 5 in the afternoon, and that's a disaster because caffeine has an 8-hour half-life, so you will never process that all of that caffeine out before your bedtime.
Yep.
Right, and that'll like make your sleep lighter instead of allowing you to get to those deeper stages of sleep.
Got it. Now, I'm one of those too, and I've seen people, hit a thing of espresso after a 8 o'clock, 9 o'clock dinner, and they go home and they fall asleep fine. And what happens there?
Okay, so see, all of that is the question is fine, right? We have a joke in my field, like the acronym WNL in medicine stands for within normal limits. Okay.
Yeah. Mm-hmm.
In my field, we joke and call it we never looked. Right.
Yeah.
So it's like he took a shot of espresso right before bedtime and he was normal. Well, if you actually did a sleep study on him and took a look at his brain waves, you'd see he'd have reduced REM and reduced delta.
Got it.
Right. And actually, the irony is we see the same thing with alcohol and actually with CBD as well. So we find that alcohol, like wine, red wine, and CBD aids people in falling asleep, especially those with anxiety, especially those with PTSD, and with what's called primary insomnia. It helps them fall asleep, but they do get a lighter sleep.
Oh, got it.
They don't get as strong delta and REM as they would as if they didn't have it.
Got it. And that's with you said CBD as well, because I see a lot of CBD sleep products, especially right now, just blowing up.
Yeah. So CBD in general is great because it's anti-inflammatory, and depending on the formulation you get, it could be anti-anxiety, right? So if someone has insomnia, what we call primary insomnia, which is difficulty falling asleep from just overthinking, right? They're just so amped up, right? They'll need something like a glass of red wine, or they'll need something like a CBD or a gummy, you know what I mean, with THC in it, and that'll help them fall asleep.
Got it.
Right.
Yep.
And the thing is, they'll swear by it and they'll say, this is the best sleep I've had in years, and this is wonderful and I love it. And it's like, well, that's probably because for the last several years, you've not been getting 8 hours of sleep. You probably have been so anxious that it's taking you a couple of hours to fall asleep. And now that you're able to get an extra cycle or two of sleep because you're falling asleep at an earlier time, you're actually getting more sleep.
Got it. What about, and I think it's important to talk about the Band-Aids that people use, and then we'll dive into some, just what are the habits that can give us a lifelong without having to rely on anything, or limit that. But, obviously melatonin, 5-HTP, those types of products, whether taken in conjunction into a formulation or by themselves. And what can you explain to the audience about what those products do and the good, bad, and ugly of that?
Okay. So both melatonin and 5-HTP, very necessary molecules for our brain health. All the DMT that's secreted in our pineal gland comes from melatonin. It's converted melatonin. But neither of those drugs should be taken for extended periods of time. They should be used in a I was going to say transitory way, where you just do it a little, like, oh, I've been having a rough time falling asleep, I'm going to take some melatonin. Oh, I have secondary insomnia, which means I fall asleep easy, but I wake up in the middle of the night. I take a delayed release melatonin, right? But the levels of melatonin people are taking are absolutely obnoxious and absurd. Okay.
Oh,
So a supplement, a one night dose of melatonin should range between 0.1 milligrams to 3 milligrams. Right. And I'm seeing people take 5 of these 3 milligram pills from Costco, like 15 milligrams, and they go to bed at night. That's what we give to Parkinson's patients. That's not that's a medical dosage. Just like too much Starbucks is, because their caffeine is so much higher than everyone else's, is like a drug, right? Taking too much of melatonin is a problem too. And just like with 5-HTP, it processes food differently. It processes your emotions differently. So I agree with the use of 5-HTP as a mood regulator, but work with a doctor, work with a physician that knows how to regulate it. Work with, at least, even if it's an acupuncturist or a chiropractor, work with someone that has regular experience with it, that knows how much to do, how much not to do.
Got it. That's awesome.
Yeah.
Well, what can you dive into with regards to just other things maybe we haven't talked about that cause sleep disruptions? You mentioned sleep apnea, you mentioned, racing mind, caffeine, alcohol, anything else?
Well, let's see. Well, I mean, just certain foods. So I'll tell you something. So one problem that is almost endemic in Western society is people clenching their teeth, like grinding and clenching their teeth, which is one of my expertise and my absolute top expertise. So we now know, this has been taken so long, that it's completely mediated by the brain. Okay. Like dentists used to think that it was because the bite was off, and that's why we clench the teeth. Okay. That's very rare that's what causes it. Okay. Not that it can't cause it, but it's rare. Right. And so what do dentists do when we look at teeth? Oh, let's grind on them, and let's make the teeth smoother and the bite better. So just like restless leg syndrome or periodic limb movement disorder, it's a centrally mediated disorder. And we now know it's triggered by, again, those disturbances in the autonomic nervous system, right? But it's any disturbances. So a few studies that came out that was a complete breakthrough in my field was that we discovered that 50% of the time we are clenching in order to restore the airway, meaning our airflow becomes so low, like we start having shallow, like kind of breathing, and the body clenches. And when we clench, we tone up the platysmal and the tongue muscles and the upper pharyngeal muscles, which then opens the airway back up, right? And then as soon as the airflow becomes smooth, then we see the clenching going away. Right? We see that about 50% of the time. The other 50% of the time, we see the clenching going on. We call it bruxism, and we don't know why, right? But like I said, it's an autonomic nervous system disorder. So if you have, like, for example, if you had a gluten and dairy allergy, okay? And by allergy, I mean an IgG food sensitivity, not an anaphylactic IgE, but IgG. If you have a slice of pizza, okay, you're going to go and clench your teeth that night.
You're talking to an Italian right now. That's not what I want to hear right now.
Right? Yeah. So then you would have the cauliflower.
No, that's not pizza. Let's just
and not pineapple. Please don't.
No, absolutely not. Absolutely not.
Yeah, I hear you. So it's any kind of, so if you have food intolerances, that'll also, so anything. So, if you have someone that they got cut off on the freeway on the way home from work that day or something, and they're still thinking about it. Oh my God, this guy just cut in front of me and he braked. He had to get to the off ramp and I almost crashed into him. And if you're still thinking about that, that's going to amp you up and you're going to clench your teeth at night. There is this relationship between the bite and the brain that we don't fully understand yet. So like, remember I told you we have those different stages of sleep?
Yep.
When we fall asleep and when we change stages in our sleep, we tap our teeth together like this. We don't know why. We don't, we don't know why we do that.
Man.
So there's still a lot to learn. I have to share with you that the field of sleep apnea is really like maybe 40 years old.
Yeah.
It is one of the youngest fields of expertise in medicine, and so we're still learning all the time. There's still so many factors we need to put into it.
Got it. Well, one of the things, you had said, and, I keep going back to kids.
Yeah.
And,
oh my God,
and how the disturbances between phones and, just life in general, not wanting to sleep, don't want to go to bed, blah, blah, blah. And then, that and the lack of sleep potentially transitioning to other things that then are diagnosed and medicated, ADHD, all these things.
That's right.
Can you talk about those, those correlations?
Delighted. Yeah. I would be absolutely delighted to talk about that. That is one of my passions. So we know that sleep apnea in children causes ADD and ADHD. This is over 2,000 published studies on it. It is a fact. It is not. There is no gray area we can say in the gray area that we don't know how it causes it or how it is resolved when you fix the sleep apnea. But when you see children with ADD and ADHD and all of them test positive for sleep apnea, and then you treat the sleep apnea and then they no longer have ADD and ADHD, you have to sit there and say, okay, that's the cause. Okay. At some point you have to sit back and go, sure, there can be other causes, right? But this is really the main cause. And sleep apnea in children is far more problematic than it is in adults. So remember those 4 stages that I talked about, 1, 2, 3 in REM? So in children, and the younger we are, so when we're born, we really only have 2 stages of sleep. We really only have delta and REM, right? Because we need the growth hormone, and every single thing we're doing is processing in our emotions. Okay? So, and you have to understand, our emotional brain center is tied in to our pain and sensory parts of our brain, right? So when you're a newborn, all you are is a bunch of nerves just trying to survive. So things hurt, you don't know why. You feel things. Obviously, you've never been outside the womb before, so you don't know what you're feeling. You're processing everything, and you need REM to process that. And then, of course, you're also growing at an alarming rate. You need growth hormones. They have very little stage 1 and 2. And then as we get older, we still have 1 and 2, but it's still very, very small, right? And again, because we're growing, right? Now, when we have apnea or snoring or a barking dog or a snoring dad or whatever, what ends up happening is we disturb way more of that delta and that REM, because that's almost all they have with the snoring and the arousals. Does that make sense? Do you follow me with that sentence?
Yep, absolutely.
Yeah. So like, for example, for an adult white male, it's considered, if you have we have 2 markers for apnea, which is way too small. But we have hypopnea, which is shallow breathing, and apnea, which is when you shut off your breathing for 10 seconds or more. And when we get the score, the AHI, which is the number of episodes you have per hour, we actually consider it within normal limits for an adult white male to have 5 episodes or less a night. Okay. In a child, let's say a 10-year-old, 5 episodes an hour is severe sleep apnea.
Wow.
You are severely impinging on their ability to thrive, to grow, to process memory. And one of my favorite research studies that was ever done was by a famous pediatrician named Dr. David Gozal, who's also a sleep specialist. And him and his wife have published so many great papers. He deserves a lifetime achievement award in not just for sleep, but in pediatrics. But he did a beautiful study, I think, when he was in the Cleveland Clinic, where he went to these local elementary schools, right? And he did like first grade all the way up to like sixth grade. And he asked all the teachers, who are the two worst kids in your class, behaviorally and, educationally, And of course, the teachers were shocked by this. You don't want to know who the two best are. You want to know who the two worst are. And he goes, yeah, we're doing a study. So he collects all these patients and he does sleep studies on them. And almost 100% of them had sleep apnea, right? I should say 100% of them had sleep disturbances. Okay. So sometimes it wasn't apnea, it was like night terrors, but the vast majority had sleep apnea. Like I think it was well over 90%. And then he treated the sleep apnea in these children, like he did, whether it was a CPAP, which I don't agree with for children's use, but whether it's tonsil and adenoid removal. And nowadays we're finding that the best way to treat sleep apnea in children is what's called functional orthodontics, where we open up the palate and let them breathe better, which is, again, one of my fields of expertise. And what he found was these kids went from the bottom of their class to the top of their class. Okay.
Holy
not
cow.
a little improvement, not
No.
a little improvement. And I get very emotional talking about this because I was one of those kids. My mom's a dentist, my dad was a pharmacist. Like, they didn't know back then that sleep was an issue, but I had bedwetting, I had snoring, I had hyperactivity, I had ADD. These are all things we know are caused by sleep apnea, right? So Dr. Gozal got 25 unsolicited letters from these parents that said, you know what, now you've completely changed our lives. Because not only did he go to the top of his class, but he doesn't fight with us anymore. He's not overeating, eating junk food. He doesn't have the urges for sweets and candy. He gets along with his siblings. He gets along with his schoolmates. His demeanor has changed. He's less defiant, essentially, And I just think that is one of the most profound things. So the American Academy of Pediatrics has recommended that pediatricians screen every single child for snoring, but they don't.
Yeah. And that's what I was going to get into, because I honestly, I've got 3 kids. I can't think of a doctor that I've ever heard talk to, or ones that we went to, that basically said, not that I don't have kids that are ADHD or anything like that, but I've never heard a correlation of saying sleep apnea in kids. Like, maybe it's a little bubble I'm in, but how is it? Is it really new, or is it still just, it's not, they're throwing it away to just give the drug out?
So I believe the recommendation from the American Academy of Pediatrics was about 5 years ago or so, maybe longer. I know we're 2020. I'm still getting used to 2021.
Yeah.
And we're in the end of March.
It's just a blur. 2020 is a blur.
But you have to realize these things take a long time for people's mindsets to change, right? I mean, let's be real honest. I'm a clinical researcher as well as being a clinician. So I'm an agnostic when it comes to science. I'm neutral, and I just say it as it is, as the way the data shows it, right? So we have major governing bodies that told us that smoking is fine and doesn't cause cancer, right? They told us that asbestos was just fine and doesn't cause cancer, right? They told us, DDT was perfectly safe. They were spraying children with DDT. Forget crops. They're saying it's so safe. You could spray it in their face,
Oh,
and then, of course, we find out decades later that it's a horrific thing to have, and it becomes banned, right? So every drug that's been banned by the FDA was once approved by the FDA for being safe and effective, right? Or at least safe. So, so it takes a long time for paradigms to change. And so, like for an adult, we know that the number one cause of hypertension is sleep apnea, right? And we have countless studies that show that when you treat the sleep apnea successfully, which is not an easy thing to do, but when you do, and they, are stable and no longer apneic, their hypertension either greatly reduces or goes away. In type 2 diabetics, we see their blood sugars dropping dramatically when they treat their sleep apnea. For depression and anxiety in adults, we see that dramatically improve when we treat their sleep apnea. The studies have shown that the severity of depression and the severity of their sleep apnea is 1-to-1. 1-to-1. Right? The JAMA, Journal of American Medical Association, had a very large study with 1,400 patients where they, age 30 to 60, where they took what's called a Zung's depression scale, and they have to rate their own depression, right? Whether it's like, oh, I sometimes have bad thoughts, to I consider suicide every day, right? And they rate themselves. And then they did a sleep study, and the severity of their apnea was 1-to-1 with their severity of their depression. And other studies, many other studies, have shown that when you resolve sleep apnea in patients with depression and anxiety, it dramatically improves their condition. We call it psychosocial conditions, but it dramatically improves it.
Wow. Yeah, I mean, that's some just fantastic and great information, and especially in the kids. I mean, because you see it all the time. You see behaviors changing so often, even just through a short term. Might not be a long term problem, but just some parents don't put those two things together. Some people don't put those two things together still to this day.
Yeah,
So
yeah.
thank you for that.
Usually, historically, it's almost comical now, but when a mom is like, a stay-at-home mom is observing their children, and they're seeing one of them is just being, a little bit, I don't know if obnoxious is the right word, but just a little bit belligerent.
Yeah.
They'll just say, you need a nap, right? And we've known this forever because they go and they nap and they wake up a different person, don't they?
Yeah.
Right.
Yeah.
So now we have all this, with all the angst we have in our modern adult culture now. God, everyone needs to just take a nap.
Yeah.
They need to get a good night's sleep.
There was something to the siestas, the midday siesta.
It's still being performed.
Yeah, it is.
Still being performed.
It is, not by all. Well, I think that leads us into, the last part, which, you gave, just that quick suggestion of take a nap. But what can you give the audience, to, help with strategies to help them get better and being able to sleep better?
Okay. Well, like we talked about in the sleep hygiene, you leave your bedroom for just sleep and just sex. Okay. There's no eating going on. There's no arguments going on. It just, your bedroom has one specific job. Your bed has one job. Okay. If two jobs, if you add the sex,
Yeah.
but just that one job. You want to avoid caffeinated beverages past noon. You want to go easy on the wine, easy on the CBD oil. I mean, honestly, use it medicinally. Like if you know your body well enough that you're like, you know what, I'm feeling, I've had a rough day. If I don't have a glass of wine, or if I don't take that gummy, it's going to take me a couple hours to fall asleep. Go ahead. We're mixing, you're taking the good with the bad, right? At that point.
Mhm.
And if it were me, if I'm not only a doctor, but I'm also a patient.
Yeah.
So if I was in that place, I would rather do CBD oil than sit up at night and not, just lay around my bed waiting to fall asleep, right?
Yep.
If I know if it's going to be that kind of a night. Of course, make sure your airway is good. Your bed partner, they did an amazing study where they did sleep studies on both men and women in the bed together, and they found on average the people that had snoring and sleep apnea had 27 arousals an hour. 27 arousals an hour. Okay. But even more damning was the bed partner with no apnea and no snoring had 21 arousals an hour.
Due to the person who had it.
Well, presumably, right?
Yeah.
But what was interesting was they started off with 1,100 subjects, and they whittled it down to 150 that actually stuck with the CPAP, right? And of course, the people that stuck with the CPAP did great. And then they asked the bed partner, how are you doing now since let's say your husband has been using CPAP? They're like, oh my God, I don't have headaches anymore. I don't have, I'm not moody. My children say I'm a lot easier. Like I'm less strict with them. I'm more understanding.
Yep.
So just your bed partner makes a big difference too.
Yeah.
Because it's not just the sound, it's the silence as well. Because the silence means choking.
Anything, there's the little LED lights, the little red LED lights that are on the TV,
dark. Yes,
Mm-hmm.
darkness is huge.
Okay.
Unplug. So you want to have your head away from an electrical outlet, right? Because there is a low-grade EMF, and our brain waves stick out 6 feet. So it is going to be affected by low-grade EMF. And light, having the room dark and cool, like around between 65 and 68, is the most ideal situation to sleep in. The darkness is huge because the light disturbs our sleep. We know this, right?
Yep.
If anyone slept or tried to sleep when they've had like a bathroom light on or something like that, we end up waking up in the middle of the night to turn it off, right?
And would a face cover work even if there's light in the room? Like if okay, that works too.
I'm very face cover as long as the face cover is not irritating.
Yeah,
because as you know, I'm on the west coast of U.S. and it gets warm, and you can start to sweat behind the face mask.
Yeah, got it.
And the temperature is important.
And then last thing, a question I had is anything with regards to mattresses. You get these sleep numbers and the different where each person's separated. Anything on that, or is that just more gimmicky?
Yeah.
Or
no. There's a lot of truth to it. I am personally not a huge fan of the Tempur-Pedic, right? I'm a bit biased. It's fine if you're the kind of person that never ever budges in your sleep. Okay. So I know I've had patients that went to bed and then they woke up like this. Like they didn't toss and turn, which is unusual because mammals are supposed to rotate an hour, once every hour, right? And the thing is with Tempur-Pedic is it's like you go on one, or that's just a brand name, any kind of foam mattress.
Yeah.
Is once you've settled into it, it's perfect. But once you turn and now it has to remold, by the time it remolds, it's too stiff, right? So I actually like those mattresses that are you can adjust the stiffness. I actually think that's a great thing, and I like the ones that can give a little bit of incline, right?
Got it. Yep.
But we're talking 5, no more than 10 degrees of incline. Yep. Right. So my bed is one of those beds that incline, and you could incline it like 30, 40 degrees. It's a bit obnoxious. It doesn't need to be such a high rake. But I actually like those beds, and especially if one bed partner likes it softer than the other or harder than the other. I always say when people ask me how soft or how hard I should make my bed, is make it as hard as you can with comfort.
Got it.
Right? In the spring mattresses that I've always had are the ones that are very stiff mattresses with a pillow top. That's what I've enjoyed the most.
Yep. One last one too, they keep coming up, is, lying on your side, left side versus right side. Is there a difference? I've heard, one side has the gut a little bit higher and it could cause some reflux, different things like that. Or is that nothing that you've heard of?
We're supposed to rotisserie, right? Mm-hmm. So people that are obese or morbidly obese, If they sleep on their left side, their heart will have more pressure on it as more weight is on the heart.
Okay.
But that's about as far as all I know about it.
Yeah.
Acid reflux, actually, we see that increase the most when we're supine, when we're on our backs.
Got it. Okay. Well, this has been great. Anything else before we kind of send us off
No.
that you want to share?
I thought you asked me some really great poignant questions about sleep. We touched on a lot of subjects. If you ever want me back to talk about one subject more in detail, I'd be delighted to.
Yeah, for sure. And also, obviously, you're up in the LA area. Love for you to just let everybody know if they're in that area where they can have access to you.
Yeah, I'm in Brentwood, and I'm in Thousand Oaks, which is right next to Westlake Village. And we're considering, as I told you before, coming out to the South Bay.
Nice.
Yeah.
Very good. Well, Doc, thank you so much. I really appreciate it. And we definitely, would love to have you on again and go into a little bit deeper, but I think this is a great overview of the importance of and some strategies. And, so many people just are popping things and they're not thinking about how that impacts it. So hopefully they got something out of that section as well. So thanks again.